Good day, grade 10 learners! Hello, this is Teacher Lester, aka Sir Les, and I welcome you all to another fun and meaningful learning. If you are new to my channel, don't forget to subscribe and hit the notification bell for you to be updated of new uploaded videos. Our topic for today has something to do with your role as members of the society. This topic is actually discussed in the first quarter of your module, and this is under the component of health. Our topic for today is entitled Consumer Health. Are you guys ready? Of course you are. So what are we waiting for? Let's get this discussion started. For you to be guided for today's lesson, here are the most essential learning competencies. The learner explains the guidelines and criteria in the selection and evaluation of health information, products, and services. Discusses the various forms of health service providers and healthcare plans. Selects health professionals, specialists, and healthcare services wisely. Reports fraudulent health services. Explains the different kinds of complementary and alternative healthcare modalities. Explains the importance of consumer laws to protect public health. Identifies national and international government agencies and private organizations that implement programs for consumer protection, and last but not the least, participates in programs for consumer welfare and protection. Under the lesson of consumer health, we will be dealing with 4 important subtopics. These are components of consumer health, healthcare providers and fraudulent services, complementary and alternative healthcare modalities, and lastly, consumer welfare and protection. Let's first deal with components of consumer health. Question. These are data and facts about health products and services you can get from media and people around you. Do you think this is health information or health services? Learners, if your answer is health information, then you got it right. Another question. Skincare products and grooming aids are kinds of health information. True or false? If your answer is false, then that is correct. Now, let us define consumer health. Consumer health is not just about buying health products and services. It is also about making decisions and having a clear and deeper understanding to make wise choices. Consumer health entails 3 components. That's health information, health products, and health services. To start with, let's have health information first. Health information is any concept, step, or advice that various sources give to aid the health status of an individual. People acquire health information and products from various sources such as authorized person, media, and technology. It is important to identify the reliability of these sources. Some reliable sources of information are medical and health professionals such as family and school doctors, dentists, nurses, and health science educators. Government agencies like Department of Health, Food and Drug Administration, Bureau of Food and Drugs, and Department of Trade and Industry. Websites ending in gov, edu, and org. Local health officials, and educational institutions. Some unreliable sources of health information are outdated customs, practices, and superstitions without scientific basis, information based on ignorance and prejudice, commercialized health information, personal options and incomplete information, and quack or pseudo healers. Next component of consumer health are health products. Health products are food, drugs, cosmetics, devices, biologicals, vaccines, in vitro diagnostic reagents, and household or urban hazardous substances, and or a combination of and or a derivative thereof, FDA Act 2009. Health products can be availed from supermarkets, pharmacies, and hospitals. Here are the guidelines on the purchase of goods and services. Number 1, evaluate which products and services will be beneficial, harmful, or useless. Number 2, know the local laws and regulations that protect consumers. Number 3, locate dependable medical, dental, and nursing services. Number 4, apply knowledge acquired with respect to personal and environmental health in the purchase of personal goods and services. And here are some tips on how to be a wise consumer. Number 1, gather correct and sufficient information. Number 2, compare and contrast details of available products. And number 3, inquire for more review if possible. Next component of consumer health are health services. These refer to the furnishing of medicines, medical or surgical treatments, nursing, hospital service, dental service, optometric service, and complementary health services. Health services can be acquired from medical and dental consultation and treatment, services from beauty parlors, and barber shops. Health services are usually offered by healthcare providers. A healthcare provider is a trained professional who provides people with health care. There are 3 subcomponents for health services. These are health professionals, healthcare facilities, and health insurance. Health professionals are individuals who are licensed to practice medicine and other allied health programs and work in the medical profession. Examples are doctor, nurse, nutritionist, etc. While healthcare facilities are places or institutions that offer healthcare services. Examples are hospitals, walk-in surgery center, health center, and extended healthcare facility. And lastly, health insurance is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Example is the Philippine Health Insurance Corporation, or popularly known as the PhilHealth. Let us now proceed to the next subtopic, which is healthcare providers and fraudulent services. Question: he specializes in diagnosis and treatment of eye diseases and disorders. Who this physician is? If your answer is ophthalmologist, then you got it right. Next question. A person's health improves soon after taking the quack's medicines. Is it a true or a false statement? If your answer is false, then that's correct. Don't you ever believe to quack doctors. Healthcare providers versus fraudulent services. Healthcare providers are provided by health professionals, while fraudulent services are provided by quacks. Don't be confused, for you to be safe always. Health professionals are licensed to practice medicine. These are individuals who are trained and licensed to practice medicine along with allied health programs and work in the medical profession. Examples of health professionals are physicians, nurses, and nutritionists. I'd like to emphasize who physicians are. There are different types of physicians that is based on their area of specialization. First is pediatrician. He specializes in children's health care and treatment of diseases. Second is psychiatrist. He specializes in the diagnosis and treatment of mental disorders. Third is obstetrician. He specializes in the care of women during pregnancy and childbirth. Fourth, ophthalmologist, who specializes in diagnosis and treatment of eye diseases and disorders. Sixth is anesthesiologist. He specializes in administering various anesthetics to assure proper operative procedures. Sixth is dermatologist, who specializes in the diagnosis and treatment of skin diseases. Seventh is cardiologist, specializes in the diagnosis and treatment of the heart and blood vessels. Eighth is allergist, who specializes in diagnosing and treating body reactions resulting from unusual sensitivity to food, medicine, dust, and other substances. Ninth is pulmonologist, who specializes in diseases of the lungs and respiratory tract. And 10th is neurologist, who specializes in providing diagnosis and surgical treatment of diseases of the nervous system. 11th is the gastroenterologist, who specializes in the diagnosis and treatment of diseases in the gastrointestinal system. 12th is the geriatrician. He specializes in the care of elderly and the diseases that affect them. 13th is the surgeon, who specializes in performing surgical operation in treating diseases, injuries, and deformities. 14th is the urologist, who specializes in diseases and abnormalities of gastrourinary tract. And 15th is gynecologist, who specializes in the diseases and care of the female reproductive organs. Now let's proceed to the health services provided by health professionals. Number 1, feeding program for elementary school children. Number 2, immunization for different diseases intended for infants and children from age 2 and above. Number 3, prenatal check-up for mothers and babies. 4th, free maternity clinic. 5th, family planning program. 6th, healthcare facilities. And 7th, health insurance. Let us emphasize the 6th and 7th health services provided by health professionals, which are healthcare and health insurance. Healthcare facilities are places or institutions that offer health services. These are the different types of healthcare facilities. Number 1, first is hospital. It is an institution where people undergo medical diagnosis, care, and treatment. In the Philippines, there are 2 classifications of hospitals. These are general and specialty. General hospitals have completed medical, surgical, and maternal care facilities. On the other hand, specialty hospitals handle a particular disease or condition or deal with only one type of patient. Second, walk-in surgery center. It is a facility that offers surgery without the patient being admitted in the hospital. Third, health center. It is a facility that caters a specific population with various health needs. And the fourth, extended healthcare facility. A facility that provides treatment, nursing care, and residential services to patients, often the elderly. While health insurance is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Health insurance examples are PhilHealth and private healthcare plans. Now let's proceed to Quackery. Quackery is a form of a health fraud An advertisement, promotion, or sale of products and services that have not been scientifically proven safe and effective. It is being operated by quack. A quack is a person who dishonestly pretends to have medical skills or knowledge. These are the characteristics of quackery. It is a big business. It multiplies and spreads fast. It is progressive. And lastly, it is claimed that it is for incurable condition. These are the possible effects of quackery. First, taking a quack cure may delay or lose the chance to be healed. Second, the person may experience placebo effect that he or she improves for natural reasons and not because of the substance that the quack provides. Third, loss of money. Fourth, giving false hopes to the sick person and the family. Fifth, the actual damage done to the individual by using the fake products and services. And lastly, number 6, it may cause overdose and over-medicines. There are 3 forms of quackery. These are medical quackery, nutrition quackery, and device quackery. Medical quackery includes cures, treatments, and remedies of various health conditions that are drugless or bloodless in nature, while nutrition quackery involves promotion of food fads and other nutritional practices that claim to be all natural. These are believed to have beneficial properties of multiple plants in one product. And lastly, device quackery makes use of miraculous gadgets such as dials, gauges, electrodes, magnets, and blinkers that are believed to cure certain health conditions. And now, let's proceed to the third subtopic, which is complementary and alternative healthcare modalities. Question: a herbal medicine for blood pressure control. Answer the jumbled letters. If your answer is bawang, then you got it right. Another question: Jenny went to buy a television but she was not issued a receipt. Is it a consumer right violation? Yes or no? If your answer is yes, then that's correct. To continue, let us define complementary and alternative medicines. These are treatments that are applied along with typical and accepted medical treatments but are not considered standard. There are 4 major domains of complementary and alternative medicines. These are biology-based practices, manipulative and body-based practices, energy medicine, and mind-body medicine. Biology-based practices are taking herbal medicine. Another one is manipulative and body-based practices, which are body kinesthetic, are concerned with movement therapy. Another one is energy medicine, uses magnetic fields of biofields. And mind-body medicine uses mental exercises in belief that the brain is central to the health. Our emphasis for today is from the first 2 major domains, which are biology-based practices and manipulative and body-based practices. There are 10 herbs that are proven and tested to have medicinal value and approved by the Department of Health, or DOH. First is Acapulco. This is for ringworm and other skin fungal infections. Second is Empalaya, for non-insulin dependent diabetic patients. Third is Bawang, for blood pressure control. Fourth is Lagundi, for cough and asthma. Fifth is Bayabas, for use as antiseptic to disinfect wounds. Also for mouthwash or tooth decay and gum infection. Sixth is Nyog-Nyogan, for intestinal worms, particularly Ascaris and Trichina. Seventh is Pansit-Pansitan, for arthritis and gout. Eighth is Sambong, for urinary stones. Ninth is Chaang Gubat, for mouthwash. And lastly, Yerba Buena, for relief from body aches and pains. while these are the alternative medicines approved by the Department of Health. First is acupuncture. It is a form of energy medicine where long thin needles are inserted to specific parts of the body to affect the energy flow. Second is reflexology. Similar to acupuncture, reflexology focuses on treating specific disorders through massaging the palms of the hand and soles of the feet. Third is nutrition therapy. Nutrition therapy approaches treatment of a medical condition by providing a tailored diet for the patient. Fourth is acupressure, which uses the same technique as that of acupuncture, but it does not use needles but hands to apply pressure on certain points of the body. And lastly, we have ventosa cupping massage therapy. This procedure is done by placing inverted glasses that have flames from burning cotton on specific points in the body. It is believed to relieve muscle and joint pains. And the last subtopic for today's lesson is consumer welfare and protection. Question: enforces laws and regulations relating to food. Is it DOH or Department of Health? Is it BFAD or Bureau of Foods and Drugs? Or is it DTI or Department of Trade and Industry? If your answer is BFAD, then you got it right. The Consumer Act of the Philippines is a law that protects the interests of the consumer, promotes general welfare, and establishes standards of conduct of business and industry. There are 3 national agencies that concerns consumer health. These are Bureau of Food and Drugs or BFAD, Department of Health or DOH, and Department of Trade and Industry or DTI. Bureau of Food and Drugs or BFAD functions are: serves as DOH key regulatory agency and implementer of the country's food control system, ensures safe and good quality processed foods, drug and cosmetics, regulates production, sale and traffic food, drug and cosmetics, and protects the health of the consumers and handles consumer complaints. Department of Health or DOH functions are: provides national policy direction and develops national plans, technical standards and guidelines in health, regulates all health services and products, inspects establishments that dispense food, adopts measures to ensure the quality of meat, milk products, cosmetics, and other consumer goods. And lastly, Department of Trade and Industry or DTI functions are: serves as the primary coordinative, promotive, facilitative, and regulatory arm of the government for the country's trade, industry, and investment activities, ensures the quality and safety of products, checks the warranty and price tags of products, monitors advertisements and retail ways in order to prevent any deception of consumer, and lastly, guarantees consumer welfare and protection. In addition, there are 3 international organizations that concern consumer health. These are International Food Protection Institute or IFPI, Food and Drug Administration or FDA, and WHO, which is the most popular, or the World Health Organization. International Food Protection Institute or IFPI ensures food protection through policies and practices for a safer global food supply. Food and Drug Administration or FDA protects and promotes public health through control and supervision of food safety. And lastly, World Health Organization or WHO directs international health within the United Nations system and to lead partners in global health responses. And for the last subtopic for today, let's familiarize the 8 consumer rights. Right to safety, right to redress, right to basic needs, right to representation, right to choose, right to consumer education, right to safety, and right to a healthy environment. And that's all for today, grade 10 learners. I hope that you have learned a lot in terms of your personal choices of products and services that you consume or get from our community. And also, I hope that you are familiarized with your rights as consumers. Thank you for watching, and this has been Sir Lester saying, let's dream and make it happen. That's all for today, grade 10 learners, and see you all on my next video. Goodbye!